Welcome to another episode of Wild and Well. Today I'm talking to fertility and IVF support naturopath Kathryn Moloney for a second time. She's been on the show before with we're talking all about fertility and it's a very popular episode. I'll link it in the show notes, but today we are talking all about pregnancy from a functional medicine perspective. So welcome. I can't wait to talk to you about this. But before we get into everything to do with pregnancy. Can you tell us one thing that you've done today to take care of yourself?
Oh, I love this question. It's the morning for me, and I've got my son off to school, so not much. But I do have a nice hot cup of herbal tea that I always start my day with. It's a jug of herbal tea, and excuse me, I find that if I hydrate in the morning with a good big jug of herbal tea, then I'm good for the day. I'm not already dehydrated, and that's such an important part of living, being hydrated.
Do you always go for the same herbal teas or do you mix it up each time?
I mix it up. Yeah, today I have a cognitive tea.
Mhm. I could use that.
Especially your time of the
Yeah,
afternoon or evening.
exactly. Yeah, it's evening over here. So, can you share a little bit about you and what it is that you do, assuming that a listener hasn't heard you on the first podcast and this is fresh for them?
Yes, sure. So I'm trained as a naturopath and I've been working in the fertility and pregnancy space for around over 20 years, actually. It's something that I started when I finished high school, and I have been consistently working in it, which has just been amazing to really develop my skills and learn about all the things that are needed to support people to have babies. And partly what we're on here talking about today is that I also provide pregnancy support and care for my patients, either patients who have just heard about me and want pregnancy support, or have my patients who have become pregnant through working together, and then we continue working during their pregnancy and I am so unbelievably passionate about pregnancy support. The reason being is I don't know how many people know this or think about it, but if you imagine, so when somebody becomes pregnant, let's say they're actually 2 weeks into their cycle, they ovulate and they become pregnant, 5 days later or 7 days later or 10 days later when implantation happens. And then 2 weeks after that, they get the pregnancy test. And then they know they're pregnant, but they're already 2 weeks pregnant by that time. And so in that period of time, up until say the 12-week scan, when you go to have that 12-week scan, that baby is fully formed. Is that just incredible?
Yeah.
They have their brain, it is not fully developed yet, but they have their brain, they have their spine, they have their arms and their legs, all their limbs, they have their digestive system. They even have eggs in their ovaries for girls. So what I think is so incredible is that in the period of when a woman is pregnant, that baby is doing all of their development in terms of developing their functional body. And so whatever happens in pregnancy is going to significantly influence their health for the rest of their life. Which is just an incredible idea. So, they can eat the best that you could possibly eat, have the best diet and the best lifestyle all through their life, but that will not do as much benefit as actually pregnancy health, as when they are actually developed and their DNA is replicating and everything is being formed. So that is why I'm so incredibly passionate about pregnancy support.
Yeah, it's very important. And it's something that not a lot of people necessarily get support in, right? They might get support later on when they're having trouble, feeling sick in the pregnancy or whatnot, but oftentimes we don't seek out support and we don't have these foods that were given when we first become pregnant to help us like get all our vitamins and nutrients in. It's not really how it's done in our society, is it?
That's exactly right. And I really think that pregnancy nutritional support is wildly unsupported. And I remember a colleague sent me an Instagram video of a doctor who was saying, we don't test for vitamin D in pregnancy anymore because what's the point? And it was just so unbelievable how dismissive it was of the really important nutrients that are necessary in pregnancy. And it's not, the other reason I'm so passionate about it is because it's not just the development of the baby. So generally, the baby is going to be pretty fine because they will steal everything from the mother. But what happens is that the osteoporosis risk of a woman who's had one or more pregnancies is enormous. Not to mention prolapse. We can also talk about that. That's something like 70%. So we need to look after our pelvic floor. But the osteoporosis risk, the nutrient depletion risk, the iron deficiency, the anemia, everything that can happen in pregnancy and all is can really impact the woman long term. However, it can also impact her postnatal health. So I'm very passionate about supporting women in pregnancy.
Yeah, I work a lot with people in the postnatal time,
Mm.
and a big passion of mine, like the books that I wrote, are really focused around postnatal depletion. And this wouldn't be a thing that we would deal with if we were properly, um, if we had enough nutrients going into pregnancy and we were able to sustain those during pregnancy and replenish them postpartum. But these are things that we just, yeah, we don't really think about until we're depleted and we're finding out that we have symptoms and then we need to do something about it. But wouldn't it be great if we went into pregnancy and we stayed there just replete with minerals?
Oh my gosh, absolutely. And that's a really good point, Hilary, because it's also about preconception care. So actually it starts before pregnancy. If we can go into pregnancy replete with our nutrients and energetic and not exhausted like most of us are,
Mhm.
we would actually have a better time going into pregnancy. And yes, we can catch it up in pregnancy. However, have a think about the fact that around 70% of women, I reckon it's probably more like 80% these days, are experiencing first trimester nausea or vomiting or hyperemesis. So I know for myself in my first trimester, there used to be this idea that if you looked after yourself before pregnancy and if you had everything replete, then you would not get nauseous or vomit in pregnancy. Now, I think that I'm a perfect example of that. It's not true. I couldn't have gone into pregnancy more replete. I had, by that time I became pregnant, I was 35. I had been studying naturopathy for 15 years. I had been trying to conceive on and off for 3 years. My nutrient levels were perfect and I was healthy. And I had awful first trimester vomiting. So what's really important is that we go into pregnancy replete, because a lot of the time in the first trimester, people are eating white bread, white foods for 10, 12 weeks. And so if you're not replete by the time you go into pregnancy, that is a time that you could become very deplete.
Mhm.
And then you're going into your second trimester already quite deplete in minerals and nutrients.
Yeah. So where do we start when we're looking at this functional medicine perspective on an optimal pregnancy? Is it starting then in that preconception time?
Absolutely. And good question. And I like that you turned that around because that was a bit dismal and doom and gloom, wasn't it? It can be a very different story to that. So I would suggest anybody wanting to try for a baby would spend at least 3 months before. Ideally 6 months, usually 6 months out, you would do a detox and, detox your body of heavy metals or anything, chemicals and that sort of thing. Get your digestive system functioning well, get all your nutrients replete within that 3 months, at least 3 months period before pregnancy, so that you have blood tests, you work out what your mineral and nutrient levels are doing, you work on your digestion, you get your stress levels down, increased energy, get good sleep, so that by the time you do become pregnant, you actually are feeling great and you go into the pregnancy feeling fantastic. And then throughout that first trimester, we do just whatever you can. Can you hear the birds in the background, by the way?
Mm-hmm. It's so nice.
Magpies right outside my window who are having a wonderful time. So, if we are going into the first trimester feeling fantastic, well, it's okay. Generally, people feel quite good between that 4 and 6 week mark. And that is a time. So, as soon as you know you're pregnant, that is the time to eat as many vegetables as you possibly can. Because from that 6 weeks is when people often become feeling quite nauseous or vomiting. And then often it goes to white foods, and you probably, you can only eat very limited foods, and some people can't even take their supplements during that time. So if we then have that between 6 weeks and say 12 weeks when they start feeling better, if it's only that 6 weeks, we can recover from that. So if you've got your nutrients replete before you become pregnant, you're going to have a much, much better time through that first trimester.
And when you talk about these minerals, like what is it that we should be focusing on? I know it's individual and we should get blood work done, but are there certain vitamins and minerals that going into pregnancy most people are already deficient or at least very low in?
Yeah, absolutely. So, the obvious one is folate. So, you definitely need to take folate for at least 3 months before you become pregnant to support neural tube health and brain development. But for a lot of people with the MTHFR gene mutation, they can't actually absorb folate. So, a methylated form or a folinic acid is going to be much more appropriate for most people. Choline is really, really important because that's also critical for the neural tube and brain development, and that a lot of that is important first thing in pregnancy. Um, we definitely need good levels of omega-3 fatty acids, which a lot of people are deficient in because they're not eating much fish these days. And you've got to be really careful with fish. So it's understandable that a lot of people aren't having enough seafood in their life. Absolutely need to make sure that vitamin D is replete, and that is at not just a sort of okay level, but at an optimal level. Iodine is also super, super important for brain development. And I just see so many people around the world who have deficient iodine because it's just so deficient in soils these days. So, and again, people aren't eating much fish and seafood. So that's really important. I would also say that zinc is absolutely critical. There's a lot of people also who are deficient in that, and especially if we have an elevated copper, that will actually bring down the zinc. So we need to make sure that zinc is really, really good levels. And going into pregnancy is also, zinc levels are really important because actually, if you have deficient zinc in pregnancy and then go into the postnatal time with deficient zinc, you can actually increase your risk of postnatal depression. Yeah, we also want to make sure that calcium is at a good level. We can also, funnily enough, by liver enzymes, we can tell what your bone density is generally like. It's not as good as doing a bone density scan, but we need to make sure that your calcium levels and your bone minerals are all at a good level, because we actually can't take calcium in the first trimester, or it's ideal not to, because that can actually reduce your calcium absorption throughout the entire pregnancy, which we definitely don't want to do. So taking calcium before pregnancy can be really useful, but you've got to be careful with calcium because it can increase having, bone deposits and kidney stones and that sort of thing. So not one to kind of mess around with. What else? Selenium. Selenium's also very, very important. So vitamin E and selenium are very, very important for placental function and placental development. Now, I could spend forever talking about the placenta, but I'll give a bit of a summary. I guess the placenta is what is an organ that is developed in the uterus that provides the nutrients to the baby. So with the placenta, this needs to be developed very, very well, because it's got all this microcirculation through it, and that provides oxygen and everything that the baby needs. If this doesn't get developed well, we increase the risk of preeclampsia and also intrauterine growth restriction. So most people would sort of think, oh, this, preeclampsia happens because of whatever's happening in later in pregnancy. And this is, high blood pressure and swelling. And, but really the risk for preeclampsia begins at conception. and there's early placental development days. So I will always make sure that I've got my patients on vitamin E and selenium if it's appropriate for them, because selenium you've got to be careful with because it can be quite toxic. And to make sure that we have this really fantastic placental development. And I love it after my patients have their babies. And I remember this when I had mine too. The doctors always, and the midwives always comment on how enormous the placenta is and how well functioning it is. And I'm also a doula, and I've been at a birth where there wasn't a well functioning placenta. She wasn't a patient of mine. And it was so interesting to see. And she had problems in her pregnancy with preeclampsia, and the baby didn't grow sort of enough. And it was so fascinating to see that placenta, say, compared to mine. It was grayer, it was just smaller, it just didn't have the kind of plump to it. So this is essential that we really support this early placental development.
It makes sense because I imagine, takes their body a lot to grow a new organ, let alone grow a baby. So that would take a lot of nutrients, and
Oh,
that
so
shows in the
many.
color.
That's exactly right, Hilary. We're not just creating a baby, we're creating the placenta as well. And, when people are in their first trimester, I always get the woman and the man, if that's the couple, or a woman and her partner. And I say to them, this woman now for the next 10 weeks is a princess.
Mhm.
She needs to do almost nothing, as little as absolute possible. Because if we're expelling a whole lot of energy and doing all the things that we usually do, like doing in life, we are just not going to have enough energy for that baby development. And the woman is going to become extremely depleted and exhausted. So, it's actually a biological function, I would say, that women do become exhausted in the first trimester because it makes them rest. It makes them rest, and this excess energy can actually go to the baby. Whereas if the woman is going to the gym all the time and working and going out to see friends and all of that, that's just not that energy for that development of the baby in that first trimester, which is just so critical, to the development of the baby and the person. So lots and lots of time on the couch, go to work, but that's it type of thing. Minimal exercise, if you can, if you feel fine, then yes, but never exercise to the point of exhaustion. We don't want to lose muscle mass. So, some body weight exercise is good, and some cardio just to keep that blood circulation, but not putting pressure on yourself to exercise and do all the things, because that can come later in the pregnancy. That's what the second trimester is for, and the third.
Yeah, and I think if you do listen to your body innately takes you through that first trimester, you do have low energy, you might be nauseous, like you're saying, and then second trimester, energy comes back and you feel strong again and you feel capable. So, yeah, if only we could listen to our bodies as we go through it, we would probably all be a lot better off.
Absolutely. And the thing is, and I was talking to patients about this yesterday actually, is that when you go into pregnancy, you have been a high functioning human being, and you are not used, if you haven't already had kids or even a dog, you are not used to sacrificing your needs for a bigger purpose or somebody else. Not saying that everyone's selfish, but we are quite selfish before we have kids. And that's just perfect, because you can be that way. But it's a big lesson in pregnancy to forego what you want to do for what you need to do. And I think the first trimester, on a sort of philosophical level, is part of that. So that we're actually changing our brain and our perspectives to doing what we need to do rather than what we want to do. Something else I was going to say there too that's important. It'll come to me. But yeah, just as much. Oh, that's it. I remember when I was pregnant and I was between that period of 4 and 6 weeks, I was unbelievably energetic, like the most energetic I'd been in my life. I guess I was really excited. And I remember speaking with my naturopath, and I think I was getting about 5 hours sleep a night because I was just so inspired. I was so just doing everything. And my naturopath said to me, that's fine that you feel good, but you still need to be getting 10 hours of sleep a night. Anyway, I started doing that. And then lo and behold, you get to 6 weeks and the exhaustion kicked in. So we do need to be careful between that 4 and 6 weeks if we're feeling really good, not to overdo it.
Yeah.
Yeah. And also protein levels are so important. So protein is always important, but in pregnancy, protein is absolutely essential for muscle building and for the baby and for brain health and adrenal health and everything. But also in the first trimester, if between that 4 and 6 weeks where you might be feeling fine, really making sure that you're getting protein in to really stabilize your blood sugar levels. So having protein, breakfast, lunch, and dinner, really good meals of protein, plus 2 snacks in between, and keeping that blood sugar stable, theoretically, if that could be your issue, would actually help to reduce the nausea.
Yeah, so fluctuating blood sugar levels or low blood sugar levels can be part of the problem.
Absolutely, absolutely. And tiredness as well. So that's where, really giving ourselves enough sleep can make a big difference. And for some people, it makes no difference. It doesn't matter what they do, they're just nauseous. And there's so many different reasons for early pregnancy nausea. I guess also, liver support. I always, as I said before, we do a detox, 6 months out if we can. Um, and I guess what I didn't say before too is that 3 month period of nutrient repletion, the baby is actually growing from then, because the egg cell is actually taking 3 months to mature before it's released at ovulation. So that 3 month period is not just critical for pregnancy and postnatal health. It's also really important because the baby's development is actually beginning then as that egg cell develops 3 months before ovulation.
And do you recommend similar things nutrition-wise and lifestyle-wise in that preconception time for both partners?
Oh, 100%. Absolutely. Yeah, for sure. Because the sperm is half of the embryo. Yeah, they're donating, 50% of their genetic material to the egg and creating an embryo. So 100%. And, I don't get me started on sperm health, but, it has declined so severely over the last 50 years. And I rarely see a semen analysis that's optimal and okay. So, that's probably, if anyone's listening and they're trying to conceive, getting a semen analysis as soon as you possibly can and having it interpreted by somebody like me, not a doctor or an IVF specialist, to get an absolute accurate reading of that for optimal levels, not just levels that are within the reference range and okay for IVF, is super, super important.
Yeah. And is there anything specifically in that lead up, that 3 to 6 month period that you'd recommend that the males focus on more than the
Uh,
females?
no, it's very similar. It's very similar. Exercise, good diet, cutting out coffee and alcohol. Um, yeah, exercise, good, healthy diet and lifestyle, Mediterranean diet. If they're a big cyclist, maybe I don't know. It's one of those things like, some male cyclists have babies no problem. It just depends on what else is going on. Whether, probably not being in a hot tub is probably the number one most important thing for a man, or a saunas, and keeping the airflow around the testicles to make sure that the temperature doesn't essentially burn the sperm. Yeah, keeping the testes cool is really important.
And in terms of supporting liver health, what do you recommend that we do in that lead up to pregnancy to support our?
Yeah. So I've got one particular supplement that I absolutely love. So, liver support supplements can be useful, but also, yeah, cutting out alcohol and coffee so that it gives your liver a break. Things like juicing, carrots, beetroot, that can be really great. Eating bitter foods, like bitter lettuce, Angostura bitters, all of that can really stimulate the liver and improve the health.
Yeah. Okay. And is there anything else in first trimester? Like we've talked about that a little bit already, but is there anything else that you think would be really important from that functional medicine perspective during first trimester that we haven't touched on?
Very great question. The thing I would say is, I guess, is more sort of medical in terms of, looking at potential miscarriage factors. risk factors. So, things like looking at the thyroid health. So I've certainly seen patients who had perfectly functioning thyroid before pregnancy, and then you go into pregnancy, and because the fetus doesn't have a thyroid until 12 weeks, it's an enormous demand on the mother's thyroid in the first trimester. So we definitely need to look at thyroid health. There are all these other miscarriage factors that are important. So whether it's clotting risk, whether there's autoimmunity, whether there's genetic or immune mismatches between the mother and the baby or the parents. My goodness, there are just so many reasons for miscarriage. So, looking at progesterone levels, making sure that, I had a patient once who ran a marathon who was pregnant and then miscarried. So I would say that sort of thing is rare, that something that the mother does is actually causing the miscarriage. Like generally the miscarriage is already going to be happening because of a chromosomal abnormality, or B is something like autoimmunity, is something to do with clotting, something to do with a mismatch, something to do with a hormone. But those things we can't those things we can improve during pregnancy, but if you don't know that they're there before pregnancy, then it's likely a miscarriage will happen. And then, that's when people sort of come to see me, and then they find out, we look together and look at all the reasons why it could happen and do some testing and find out what the cause of the miscarriage was. So then we can improve the chances, treat it, and improve the chances for the next pregnancy.
Yeah. And if it comes to autoimmunity or thyroid issues, which often are caused by autoimmune conditions like Hashimoto's, what do you recommend that people do? Like, are there some go-tos that we can do to support ourselves, or is that very
Sure.
individual?
Oh, so individual, and also, it's a medical necessity. So often I will work with people with their GP or their endocrinologist or rheumatologist to support. The funny thing is, I'm usually the one saying to my patients, go to your doctor and ask them for this medicine. Because I've worked in this area for so long, I know what functional medicine approaches I can use, and I know when pharmaceutical interventions are required. So it's not always something we can improve by diet and lifestyle and supplements and nutrition and herbal medicine and all of that. There's sometimes situations where people need pharmaceutical medications. They might not necessarily want to take them, but we need to do a risk benefit analysis as to, is taking this medication going to allow you to hold the pregnancy and carry to full term.
Yeah. Yeah. So if you're on thyroid medication, like it's important to, I imagine, stay on that. And if you have low
Oh, for sure.
progesterone, you might want to check that out, right?
Yes, absolutely. Yeah, and that's, it's an interesting, uh probably what I didn't say before when I started talking about how I think under respected pregnancy is and the impact on the woman's body.
Mhm.
When people are working with me, they do a lot more tests during pregnancy than the doctors will do. And I think that's such an important aspect of working with somebody like me, is that we don't just go for what is, I guess, medically necessary. We go for what is optimal to support the development of the baby, the health and the long-term health of the mother, and also supporting the postnatal health. So it's not just like, oh, we need to make sure you're not anemic or not deficient in vitamin D. It's way more to it than that.
Yeah. So is that the main difference, or one of the main differences between doing more the conventional medical approach and working with a functional medicine practitioner like yourself?
Yeah, that's right. And things like they will test the glucose tolerance test at 26 weeks. I won't start thinking about blood sugar at 26 weeks when we find out whether you've got diabetes or not. I will be thinking about blood sugar as soon as you are pregnant and preventing you from having a diagnosis of gestational diabetes at 26 weeks. So that model works the other way, where they're like, oh, you've got it, let's do something about it. I'm like, no, let's prevent it from happening before it happens. I think there was one patient that I have who, in my entire 20 years of working, that has developed gestational diabetes.
Wow.
And the reason being is she didn't follow my recommendations. So I believe that there is so much that we can do to prevent these conditions. And preeclampsia, that, the medical model is, oh, you've developed preeclampsia, and then they'll start treating that. I will go right back to conception. How do we prevent preeclampsia in this woman?
So with gestational diabetes, what do you recommend as just like the baseline of what people can do to reduce their likelihood of developing it?
Yeah, so like some people are more prone to gestational diabetes. They might be overweight, or they might have had a family history of gestational diabetes or diabetes. They might have high insulin levels. So this is all what I do with people before pregnancy, is to make sure that we improve this blood sugar control then. So that then when you do go into pregnancy and you're in the first trimester and you can only eat white carbs, it's not going to go completely crazy, because we already know that you have this tendency. We've already improved it a lot. You've already learned about all these hacks and things that you can do to control your blood sugar. And then as soon as the nausea is over, we can get you eating again, making sure you're getting regular protein, keeping your sugar levels intake down, exercising, keeping, adequate weight control. Um, and things like going for a walk after meals can reduce your insulin reactivity. Apple cider vinegar, it's got to be pasteurized before meals, things like that. There's a whole lot of things we can do to improve blood sugar during pregnancy. But look, I wouldn't say that it's easy, because pregnancy is a situation where blood sugar levels can be completely dysregulated. So it's complex, and I certainly give my patients supplements who need them. I'll put them on them right from the first trimester or second trimester to make sure that they don't develop gestational diabetes, because it's horrible, and you might have a bigger baby, which can then impact pregnancy, labor outcomes, and also you're more likely developing diabetes later on in your life. So that's something I absolutely want to not want to prevent in my patients.
And what about preeclampsia? Like you were mentioning that before when we were talking about the placenta, but are there any things that you recommend that all women in pregnancy do to reduce that likelihood? Because that seems, I've known a few people who've gone through that, and it's not something that you want to go through.
No, absolutely not. And again, so I had one patient develop preeclampsia in my 20 years, which I think is pretty extraordinary. And the reason she developed it is because she came to me. I didn't do preconception care with her. She came to me because she had a test through her doctor that showed that she had a higher likelihood of developing preeclampsia. And so the amazing thing is that she didn't develop preeclampsia until she was 41 weeks and 2 days. So I take that as a huge win. And by then she was just going into labor anyway, and it was perfectly fine. So that was such an incredibly great story. And her doctors were shocked, that she was able to prevent preeclampsia from happening until that time. So, with her, I mean, a lot of this is supplementation. It's not just nutritional medicine. So, and I definitely can't give supplement recommendations in a way like this, because what's right, it's individualized medicine. What's right for one person is completely wrong for another. But yeah, certainly supplementation can really do absolute wonders for preventing preeclampsia. And yeah, looking after your weight, looking after exercise, looking at diet and sugar and all that sort of stuff is really important. And I should say, actually, I have mentioned weight a couple of times now. It's really super important that that pregnant women aren't shamed around weight, and that it's looked at through a really body positivity lens. And, I had a friend who had one baby in France and one baby in Australia. And her experience in France was absolutely horrendous in terms of the doctor telling her that she was putting on too much weight. And she is absolutely tiny. And it was just so devastating for her. Then compared to then having a baby in Australia, and her weight was barely checked. And I'm noticing this more and more here and in the US, that patients' weight is not, pregnant women are actually not being weighed, which I actually think is fantastic. So for most people, so my experience, when I went into pregnancy, I was probably a BMI of 21, so I was quite small, and I put on 20 kilos. which for those of you with in the pounds, that is over 40 pounds. So that would seem like that was an enormous amount of weight because you should only be putting on 12 kilos, but it's individual because, well, one, probably because I had such a big placenta. Two, because I started off with tiny boobs and ended up with enormous boobs. But also because I was so small when I went into pregnancy. What is super important is that small women put on a lot of weight. So then we have resources for breastfeeding. And I remember going in thinking it because I had a bit of blood sugar regulation. I was always hungry. This was just my normal way of being, high metabolism. Then I thought, oh, breastfeeding is going to be terrible. I'm going to be hungry all the time. I was not hungry during breastfeeding. I did not have blood sugar regulation. I was stable as, and because I just had so much fat that I could turn into breast milk. And then lo and behold, I don't know, 6 months after breastfeeding, and I was back to my previous weight pretty much. So I think it's super important that weight is not over, that we don't put too much pressure on women in terms of their weight gain. And, for me, I had to eat a main meal every 2 hours in my first trimester. So I put on huge amount of weight in my first trimester, but that's what I needed. So I think it's super important that weight is looked through a really body positivity lens. And certainly the other situation is women who are obese when they go into pregnancy. We do need to really monitor that. And I've worked with a few women who are obese in their pregnancies, and it was amazing. Like because in that situation, you almost don't need to put on any weight at all. And that's what helps to reduce gestational diabetes risk and preeclampsia. Not no weight at all, but not very much. And it's amazing to seeing these women, especially if they're exercising and really healthy in pregnancy, actually how amazing they feel. So weight is a really interesting topic during pregnancy that I just think needs to be really, particularly, women who have had eating disorders in the past. You would know probably all about this, Hilary, just about how much we need to really support women during this time. Because, for instance, I was speaking with a woman yesterday and she's like, oh my gosh, I always thought I was really body positive, but I've got cellulite in my arms. She struggled with that. And we had to go through that whole conversation around, well, you need to put this on for breastfeeding. And, if anything, if there's time when you can't eat for a period of time, this is really positive. And it really changed her mind to be like, okay, actually, this is fine. I can feel better about my body now, because your body changes. She said, I just don't recognize my body anymore in such a short period of time. And she was only 21 weeks pregnant. So, it's a really interesting change for women.
Yeah, the mindset is such an important piece. And I think through you talking about this too, about weight, it just reiterates your point that it is individual, that for one person, they might need these supplements. For somebody else, they might have to monitor their weight. For somebody else, they don't. Like everything is so individual, even though it's a very common and normal experience to be pregnant, we still will go through it with our own challenges and strengths, won't we?
For sure. And it's one of those situations where whatever is your tendency is probably going to become exacerbated.
Mm.
If you've got blood sugar regulation, that will become exacerbated. So, if you're prone to stress, that also may be exacerbated. In saying that, I would say for me that my pregnancy was probably the most relaxed I've ever been in my life, because I had higher estrogen levels and I felt absolutely fantastic. But similarly, I have back issues, so my back issues became worse. Things like that. So it's really good to know that before you go into pregnancy too. So you can be like, okay, what are my biggest challenges? Let's see if we can improve those so that they're not such an issue in pregnancy.
Mm. And can you talk to us about the second trimester? Is there anything that we really need to know from a functional medicine perspective for the second trimester? Because this is a trimester that I think we forget about sometimes because first trimester is like quite significant. And then third, you're feeling really big. But second gets forgotten about because it's
It
almost a bit
does.
easier.
this is the time to get it all back on track.
Mm.
So it's really interesting because most people have really a big struggle with vegetables in their first trimester. And if I see somebody at 12 weeks and they're still nauseous, they're still not eating their vegetables. And then I see them at 16 weeks and they're like, oh, I haven't reintroduced vegetables yet. And I'm like, oh, okay. This is a tricky one because there becomes an association with things that you haven't been able to eat. And you really have to change the mindset to be like, now I can eat this and I need to eat it. So I see this kind of lag of people not taking their supplements, because they're a bit scared, or maybe that's going to make me nauseous again, or I'm not going to eat this broccoli because it might make me nauseous again. But there's a lot of mindset work we need to do there to actually be like, no, this is done. And now I'm going to go back to a healthy diet and lifestyle. And this is where you start exercising again. This is where we start, we really look at the minerals and the vitamins to see what happened, what happened during the first trimester. Where are you now? This is when we start giving calcium. We might give zinc again. We'll look at blood sugar. We certainly look at iron. So generally, some people really are averse to meat. So that iron levels might plummet during the second trimester. And also at around 20 weeks, we have this experience of hemodilution. Now, this is where your blood volume, I don't want to say doubles, but it gets a lot more, and there's a lot more blood being developed in the baby. So our ferritin and iron levels can go through the floor. Now, this is not necessarily, I think this is what happens is that I think this is not well understood. And in the medical mainstream system, often it looks like the ferritin is super low and they're given like super high dose iron, and then, oh my God, you're anemic. But it's not necessarily the situation. But we need to make sure that before this hemodilution happens at 20 weeks, that we are making sure we have really robust iron levels for when that happens. But also, giving high dose iron is not a good idea because it's very oxidative, and that can have issues with the baby development and the placenta. So yeah, all the nutrients, getting those back on track, getting back into exercise. So muscle development, muscle building in pregnancy is so important, particularly if you want a natural labor, because pregnancy itself is like running a marathon. The way that our metabolism is going and whatever is happening in our body is quite similar to running a marathon, would you believe? But actual labor itself is a full-on marathon. And, I just think this is hilarious, but my labor was 56 hours. And if I had not exercised during pregnancy, no way could I have gone through that. I mean, there is a well of energy that comes from somewhere when you're in labor, which is just phenomenal and amazing.
Yeah.
But you need to make sure you've got damn strong legs.
And your core strength too, right? Like there's so much breathing and the core strength, like it's a
and
lot.
your pelvic floor. Looking at after your pelvic floor in pregnancy is something that is so important, and a lot of people don't know how to do that. So getting really good support through a physiotherapist or physical therapist to make sure you are strengthening your pelvic floor is so important, and making sure you don't over tighten the pelvic floor, because if you've got a hypotonic pelvic floor, it's going to be hard to get the baby out.
Yeah,
Yeah.
I hear about that quite often, and it sounds like that's almost more common than your pelvic floor not being strong enough.
Well, the problem though is that hypotonic also means you have a weak pelvic floor.
Mhm.
And this is where it gets confusing. It's like, oh, I've got this hypotonic pelvic floor. It's really strong. I don't need to work on it. What you need to do is work on relaxing it and then strengthening it. So the pelvic floor is complex and complicated. Yeah, but if if your hips are strong, less likely to have hip, what's it called in pregnancy? Um, oh, I can't even think what it's called, but where your hips, turn, or I've lost my words all of a sudden, where your pelvis rotates and shifts, and all sorts of hip issues, and pubis synthesis issues and things like that too. So, and certainly going into pregnancy, like if you can go into pregnancy full of muscle, fantastic, because it'll get you through that first trimester where you can't really exercise. and then you can pick it back up in the second trimester, and you haven't done too much damage.
And what about third trimester? Like from this functional medicine perspective, what are we doing in that time to have an optimal pregnancy, birth, and support us into postpartum?
Yeah, so this is really where the mindset work happens, I believe. This is where you go through a big journey into preparing for the baby coming. I will say that I believe that the preparation for a baby is sidelined by preparation for the birth. So people will go on into a birth and have all the information about their labor and their support and everything all done pat. Baby comes and it's like, oh my God, what do I do with this thing? I think we are woefully unprepared for having a small human in our care, and particularly a baby who's just fresh into the world. So I would support anyone listening to do some preparatory work around actually having a baby in their care. And look, to be honest, how does that look? I'm not entirely sure. Having had one now, I guess I don't exactly know what I would tell people, but there would be people out there who are, who are doing this, who are trying to prepare families for bringing a baby into their life. As it's a big shock, and also, making sure that all the meals are in the freezer and you've got a lot of support, and all of that is so, so important. So I think during the third trimester, we're doing all of this, and the nesting and the things for the baby. And look, I would say the actual things for the baby is less important than making sure you've got support. And things for the baby, we've got marketplace these days. You can get anything you want close by. You don't even know what you'll need practically until you've got the baby, because every baby is different and the way you want to do it is different. So I think this is, yes, prepare for the labor, but please prepare for the baby. And mindset wise too, how are you going to be spending your days? If your partner's going back to work, are you going to be home with the baby for 12 hours a day by yourself? How is that going to be for you? Are you an A-type personality that hasn't sat still for your whole life? Well, probably you're going to find that quite difficult. And potentially, are you somebody who suffers from loneliness? That might be quite lonely for you. So what can you put in place to make sure that you are not home by yourself all the time? Can your partner work from home for a long period of time? Do you have family support nearby who you can say, can I see you on these days in preparation? I think that the postnatal loneliness is something that does not get talked about enough, and is not, and people don't prepare for enough, because they have no idea. We just have this idea the baby's going to come and life is going to be amazing. And it's not that it's not. It's going to be fantastic and new, but you are going to become, you're birthing yourself at the same time. You're birthing a mother at the same time as you're birthing your baby. You are transitioning into becoming a mother. And this is big. So you want people around. Not everybody will. Some people don't. And they want to be by themselves and by their baby to make this transition. But a lot of people will need friends and family around on a regular basis. Yeah.
Yeah,
And
I'm so happy that you addressed that. That's so important.
well, that's such an important part of your work, isn't it?
Yeah, and talking about pregnancy, I just appreciate that you talk about the postpartum, because sometimes we can just have that tunnel vision and be like, okay, pregnancy, there's so much to know in it. There's so much that we can do to optimize it. And yet this is still a piece of what you talk about, which is so critical, because the pregnancy does end and then
Yeah.
there's a baby. So this is a continuation of that.
That's exactly right. Yeah. And some people sometimes get so focused on the birth that they then have a baby. Then like, what do I do now? I know nothing about this. So, let's prepare people so that they're not in that shock. Spend some time with people with young babies, or sit in their living room for 2 hours with them and see what it's actually like. So it's not completely unfamiliar when that happens. And in terms of preparing for the labor, very, very important. So, as I say, I'm a doula, so I'm very, very passionate about women getting enough support during their labor, and that not being from their partner and not being from their mother during labor. They need to be a fully full-fledged, powerful woman, not with their mother in their mother in the room. That might be controversial, but that's what I believe. And, not also relying on your partner because they've generally probably never been at a birth before. They will be freaking out because they're seeing you in massive amounts of pain and they're not going to be able to support you. So, get yourself a doula or get yourselves midwives who are independent, or make sure you've got a good situation at your birth center. But yeah, I'm very, very, very passionate about labor support. As I said, my labor was 56 hours, and I had my best friend who had been at many births and had her own two very challenging pregnancies, which ended up which were actually weirdly very similar to mine. And my husband and my doula and my sister-in-law and then the midwives at the hospital. So I wouldn't necessarily recommend that many people being at your birth. We didn't actually intend for my sister-in-law to be there, but because it was so long and we needed someone to feed people and to wash towels and dry towels and all of that, that was absolutely invaluable. But yeah, making sure you've got people on standby is super, super important. But then from functional medicine perspective, yes, we're looking at preventing postpartum depletion in the pregnancy. So we're looking at iron and B vitamins and magnesium. We're looking at calcium. We're looking at your adrenal glands. Like, are you overdoing it in pregnancy? Are your adrenal glands becoming depleted? You need to go into postnatal with really robust adrenal glands because you are not going to sleep. Most people will not sleep very much in that first year. So if we can get you at least in the first 6 months, so if we can make sure that your adrenals are top notch, and so that you have all of this adrenal energy, I don't know how to put that better, but your adrenals are completely replete, so that they are going to take a lot longer to deplete before you get that full postpartum burnout and depletion. So this is very, very important. We also need to look at your microbiome. We're also looking at things like are you and your partner, or the father of the child, or the donor biological father, gosh, I'm really mixing up my words right now, do they have atopic issues? Do they have eczema? Do they have asthma? What do we need to do during pregnancy to reduce the risk of this happening? Looking at your microbiome, because the microbiome, we would do this all through pregnancy too. The microbiome changes a lot in pregnancy under the influence of estrogen. So we need to make sure that your microbiome is functioning really, really well. And also, things will also change postnatal as well. So always looking after the microbiome. And as I said, making sure that we have replete zinc levels to prevent postnatal depletion and depression. And also looking, are you somebody who is anxious? Like, have you had anxiety at different periods of your life? Well, then in which case that may come back in postnatal time. So what do we need to do in pregnancy to really restore your nervous system so you're in a really strong place? What do we need to talk about in terms of structuring your life postnatal so that we can reduce the incidence of this happening? Are there meditations that you like? Is there breath work that you do? Do you do yoga that is possible to do postnatal? Having those things in place, if you know that you are prone to anxiety, is very, very important.
Yeah, that's so much there. It's so good. All really important things to address: microbiome, right? Our stress levels, our adrenals, everything, our nutrient levels. So many
Absolutely.
things to look at. Yeah.
Yeah. Absolutely. And yeah, going back to that microbiome too, the microbiome is so responsible for stress and anxiety. So from that perspective too, we need to make sure that that's in the right place.
It's all connected, isn't it? Like everything is intertwined, right? Our bodies, our minds, they're all connected.
And talking about the microbiome, we would also look at that prenatal as
Right.
well, so that you're going into pregnancy with a robust, if there's parasites in the gut, or there's gut bugs that are causing issues, if there's SIBO, we need to sort that out before pregnancy, because that's not the sort of thing you can treat during pregnancy, and it will probably most likely get worse in pregnancy if it's there prior.
If somebody doesn't address those things, in preconception? Is it just about doing the best you can with like what's safe in pregnancy and then addressing them postpartum?
For sure, absolutely. And what it might sound like is that I'm going for absolute perfection now. But that's generally impossible. And if we strive for perfection, then we're going to get super stressed. So,
Mhm.
life is messy and not perfect, and that's okay too. We do the best we can.
Yeah. Was there anything that you really wanted to make sure that we spoke about or that we mentioned that I didn't ask about or that we haven't talked about yet?
Great question. Um, I guess maybe the Group B strap. So, women will have a swab at around 36 weeks to see if you've got Group B strap. If you do, then you'll need to be on antibiotics after the waters break. Um, so that's an interesting one, and that's something that I try to reduce the incidence of before that test, so that it's more likely that people will test negative to that. And if they do become positive to it, if they do test positive, then we try and treat it and then retest them before the labor to reduce the chance of having to have antibiotics.
And is there anything that you recommend that people do for that, or is that more of an individual thing?
It's individual because there's particular probiotics that help that, but we've also got to be careful about things if you have too many probiotics for that you can actually increase the risk of what's called cytolytic vaginosis. And that's where you have too much good bacteria in your vagina. So it's tricky to make recommendations on that. I'm just thinking what yeah, it's I just wouldn't want to make any hint at anything, because if someone went and did it and then did the wrong thing and it caused more issues, then that would be problematic.
Yeah.
Mm.
Well, I think a lot of this conversation, like there's so much useful information, and it also highlights that it is individual, that we should be working with somebody so we can know what tests to do, know how to interpret the tests, and just have a streamlined approach to
Yeah,
whatever our challenges are. It makes it so much easier when we have somebody like you who has 20 years of experience in this area to let us know what we do rather than just fumbling in the dark with first pregnancies, even second or third. Like there's still so many things that you don't know.
absolutely. And second, third pregnancies too, you're busy, really
Yeah.
busy. And people often forget that they're pregnant. So, I have a package that I do, in the first trimester, I just see people as need be, usually when they have pregnancy confirmation, and then sort of maybe 8 weeks. And then from 12 weeks after the scan, I have a pregnancy package. So then I see people at 12 weeks and 16 weeks and 22 weeks and 28 weeks. 34 weeks, and then just before the labor as well. And what we're doing there is ensuring that we are not missing anything. Because what will often happen is that people will have an iron test at some point and be like, oh my God, I'm totally anemic. Or, whoa, I'm so low in vitamin D. How long has that been happening? Um, and same with iron, there's riskless postnatal depression with low iron levels and pregnancy depression. Um, so it's just, I think, wonderful for people when they don't need to actually navigate it themselves. And, the doctors are just not testing enough, in my opinion. They're just exactly, we find out you've got gestational diabetes, or we find out you've got anemia. But how long have you had before? What damage has that already caused? So, yeah, I think seeing somebody regularly through pregnancy means that these things just don't get missed. And people are really supported optimally, and they feel fantastic in their pregnancy. There's so many people who just think that pregnancy complications are the norm of pregnancy, or are in total denial. Like, oh, I've never had anything wrong with me in my life. Why would I have any problems in pregnancy? And yeah, maybe focus on the birth, or, focus on the excitement of having the baby without supporting themselves adequately and the development of the baby. My little kid is so smart, and I'm sure, and people say to me, far out, that, particularly people who've had babies with me in preconception, helping them to become pregnant, they are shocked as to how intellectually, cognitively advanced, or very, very smart they are, because we are actually providing the nutrients that their brain needs for optimal development. Um, and yeah, I feel like I'm biased here, but the babies that come out that I work with, they're so gorgeous. Do you know what I mean? They're plump and they're good color, and you can just tell that they have received what they've need to receive during pregnancy.
Yeah, it brings us back to what you were talking about at the beginning of why it's so important that we care for ourselves when we're pregnant, because it impacts our children forever, right? Right from when they're born, the whole trajectory of how smart and how healthy they are, it starts then.
It does. It really does. And also if a woman can have a healthy postpartum period, how the impact on the rest of their children's life and their life, that can make a huge improvement. So yeah, I just think it's very, very important.
And can you tell us how people can work with you and what that looks like? I know you've talked about it a little bit here, but if there's anything more that you want to let people know.
Yeah, so in terms of my fertility practice, I have a 6-week program that I love people to do. It's a part group program and part one-on-one consultations, so 3 one-on-one consultations and 6 weekly group calls, which are so sweet. People just love connecting with other people who are having fertility issues, being able to talk about it, answer all their questions. It's just so nice. And that's got 6 modules as well. And so that's probably my favorite way of working with people. Otherwise, I do sort of an initial consultation where I go through every single thing. So I will look at everybody's blood tests that they've had forever, anything that you've got access to, all your IVF history if you've done IVF. We'll look at all the blood tests, put them together, look at what needs to be done, make supplement recommendations and dietary and lifestyle recommendations that are specific and not just telling you to do everything. Because yeah, I really weigh up the impact on people of their diet and their lifestyle choices and what they feel like they have to do as opposed to what they can do. So that's a really important factor. Um, and then and then in pregnancy, so I have my pregnancy package. I also have a perimenopause package for people going through that. I also do a postnatal package. So I see after people have given birth, I see people all through their postnatal period. So at 2 weeks, at 3 months, at 6 months, and then 12 months. And so we can really make sure we're supporting your adrenals during that time. We're supporting your nervous system. We're supporting you to make sure you're eating and drinking and getting sleep and exercising. It's a really nice experience for people where rather than everybody focusing on their baby and them focusing on their baby, we take it some time out and be like, okay, what do you need and how can we support you, because you are the mother and you're the very, very, very important part of this picture. We also talk about introducing solids. We talk about sleep. We talk about nutrition and everything for the baby as well. So yeah, that's all on my website. Access to that is through my website.
And if people don't look at show notes, like I'll have all this in there, but if they're not looking at show notes, can you just let us know what your website is and where they can find you on socials?
For sure. My website is www.fertilityandbeyond.co, not com, .co. And I'm on Instagram, fertilityandbeyond.co.
Okay, amazing. Well, thank you for coming on here and telling us so much about pregnancy. And if somebody's pregnant right now or thinking about it, I'm sure they got so much out of this. And yeah, thank you for the work that you're doing because you're changing the lives and the next generation, which is massive work.
Thank you, Hilary. I appreciate it. And thank you for the work that you do too, because that postpartum time is so important, and it just makes me so happy that people are really, really acknowledging what happens for women and the transition and the support that they need during that time. Such a precious and beautiful time that they need the support as well. So thank you.